Hello everyone. Today I will discuss about what is mumps virus. It is actually a disease that is caused by the mumps virus, which is a member of the Paramyxoviridae family. This is actually a large family of the viruses that include the measles and the parainfluenza virus, and this will affect the children the most. Mumps only affect the humans and is spread by the tiny respiratory droplets that are small enough to be carried through short distances in the air. Mumps virus has a single strand of the RNA and the viral polymerase enzyme that is surrounded by a phospholipid bilayer. Its envelope is studded with the viral proteins, for example hemagglutinin and the neuraminidase, or it is also called as HN protein and the fusion of F protein. So, mump virus is very contagious and anyone near a person with the mump is at risk for getting disease as well. HN protein allows the virus to stick to a host cell. F protein, which fuses the viral and cell membrane together, allows the mump virus to enter the cell. And when mumps enter a cell, the single-stranded RNA, which is the negative strand, gets transcribed to the positive sense. It is translated by the host cell ribosome into the new copies of envelope proteins and get assembled into new virus. Mump is actually the swelling of the parotid glands on the face that is either be on the one side or on the both sides. HN and F proteins on the cell surface bind to each other and forms a clump of connected cells, which is called as multinucleated giant cells. There are some signs and the symptoms of the mump virus, which is fever, headache, muscle ache, tiredness, loss of appetite, and the swelling of salivary glands. Mump enter the body and first infect the epithelial cells of the nasopharynx, replicate and cause the local damage to the tissue. It can also affect the testicles and the epididymis in the young boys. If it affects the testicles, it causes the orchitis, and if it is epididymis, it will cause the epididymitis. And that results in testicular atrophy, decrease in sperm count, and cause the infertility. Less commonly, mumps also affect the kidneys, which cause glomerulonephritis, which leads to hematuria and the proteinuria. It can also affect the joints by causing arthritis. As a final note, the pregnant women with the mumps are not an increased risk of having a baby with the congenital defects. You can diagnose it by the physical examination that confirms the presence of swollen glands, and if there is uncertainty about diagnosis, a test of the saliva or blood may be carried out. There is no effective antivirals for this. We can take bed rest, plenty of fluids, paracetamol to reduce the pain and fever. MMR, which is the live attenuated vaccine, is given to the children of the 10 to 15 months. This vaccine is 90% effective and reduces the occurrence of mumps. Thanks for watching.